Across the country, the coronavirus is posing a special challenge for nursing homes and other facilities that provide care for the elderly. More than 2 million people in the United States live in long-term care facilities. Joining me now from Rhode Island to talk more about this from both a medical and a Catholic perspective is Dr. Timothy Flanigan, professor of medicine in the Division of Infectious Diseases at Alpert Medical School of Brown University and a Catholic deacon. Dr. Flanigan, welcome back to the show. So how big of a risk is the coronavirus to the elderly and other people living and working in nursing facilities?
If folks are older and they become infected, it can be very serious. It primarily causes pneumonia, and many individuals might have underlying lung disease. And that's why the CDC's advice is that those that are older should be very, very careful, because we can do a lot to prevent exposure. No handshaking anymore, good cough etiquette, good hygiene, and if you're sick, stay at home. But of course, some of our elderly, including my own relatives, they need help. So really good hand hygiene is the key. There's so much we can do in the community to prevent the spread of this virus.
Dr. Flanigan, let's talk about, the family and other visitors who come to those facilities. What's the impact, and can they raise the risk of possible infection?
Sure, absolutely. So this is a time where folks will have fewer visitors. There are times where facilities will stop having visitors. That's okay. Then we need to use our technology to Skype and FaceTime and reach out. And we need to be careful that whoever visits is healthy, doesn't have a respiratory illness. And when we do visit, really good hand hygiene. Using those hand gels really works. We can make a big difference.
Do you know what the nursing care facilities are doing in response, and are there protocols that are in place now for the coronavirus?
Yes, there are. They've got signs outside saying if you've got a respiratory illness, don't come in. Visit at another time. Make sure you use the alcohol-based hand gels or wash your hands. And don't go shaking all sorts of people's hands. You're there just to visit your relative, and stick to that, which is good. Give the support you need to. We can't all isolate if we all have jobs to do for our family, for our friends, for our community, for our work. So we need to be out and about, but we can stop the spread of this virus, which is usually person to person, hand to hand.
Yeah, and you talked about that, washing your hands and using hand sanitizer. For families who have loved ones in these facilities, though, what precautions, that is, should they take, and what should they be on the lookout for?
Well, the symptoms of COVID-19 pneumonia are fever and a cough and shortness of breath. So people that become ill can become very ill. We've seen this. So we can help to prevent the spread by following all those things we talked about. That's the key. And the most important thing is sometimes, when you're sick, you figure, oh, what the heck, I'll go anyway. This is a time where if you've got a cold, just stay at home and hold off.
All right, Dr. Flanigan, thank you so much. Great advice as always. Dr. Timothy Flanigan, again, thank you for your insight.
Thanks, Tracy.